As you can see in the images on this slide, this podcast is going to be about the calculations required to safely administer medications by the intravenous, often referred to as IV route of administration. Intravenous infusions actually can be categorized as either rapid, intermittent, or continuous. The rapid infusion of medication into a vein is termed IV push. Now, IV push administration is usually conducted in 1 to 5 minutes, depending upon the medication, and these medications are usually in syringes and have relatively small volumes of anywhere from 1 to 10 milliliters. And either the nurse really stands there looking at the clock, slowly pushing on the barrel and the plunger of the syringe to push the medication in over the required amount of time, or syringes can actually put into computerized IV pumps that actually push the plunger in over a set period of time as well. Either way, the small volume of fluid being administered usually via a syringe into the intravenous port is termed an IV push. Now, the second type of infusion is called an intermittent infusion. And these are small volumes of bags, ranging from anywhere from 50 to 100 milliliters. So the bags are relatively small. And the administration of those volume is usually over anywhere from 15 minutes to an hour. So a smaller volume, 50 to 100 ml, administered, say, in 30 minutes or in an hour. The trick with these intermittent infusions is while they're only administered over a relatively short period of time, say 30 minutes, they are then left there and waited and that dose repeated at a set interval. So say in 8 hours or maybe again in 12 hours, they would administer another dose, but the administration of that dose only takes about an hour. So it's like taking a tablet or a capsule by mouth every 8 hours or 3 times a day, but it's an IV being infused over 1 hour, stopped, and then not infused again until the set interval later. And those are termed intermittent infusions. Okay. Now, on the other hand, a continuous infusion, basically these infusions run large volumes of fluid ranging anywhere from 250 to 1,000 milliliters and do so into the vein continuously, but at much slower rates of infusion than the IV push or intermittent infusions tend to be administered at. Now, looking at the picture on the far left of this slide actually shows a large volume IV bag which contains about 1,000 milliliters of the Hartmann solution. Okay, this solution would be continuously fused into the vein. Okay. Now, to the right of that is a much smaller bag in that same image, and that bag would be considered a piggyback since it is a smaller volume, intermittent IV infusion. And in this picture, most likely an antibiotic, which means they would run that much smaller bag in, say for 30 minutes, and then just leave it there. It would be left empty until the next dose is actually needed to be infused at some point later, such as 6 to 8 hours later. Okay? So, now, another concept to get is that the actual passage of an infusion solution into the patient's vein may be assisted by either gravity, that is, the solution is hung on a stand well above the portal of entry, or alternatively may be infused by an electronic volumetric infusion pump. Starting with gravity infusions only consist again of a bag, an IV line with a drip chamber, and an access port to the patient. When nurses are required to use gravity tubing to run an IV, they are basically infusing an IV fluid at the rate gravity causes the IV fluid to drip into the chamber. Now, the picture in the middle of this slide shows a close-up shot of a drop of fluid just about to drip into a chamber. Now, how fast the fluid is dripping into that chamber will be based on the drip chamber for that specific IV line. Different IV infusion sets have different drip rates, meaning how many drops of fluid you will see falling into the drip chamber in any 1 minute. Now, based on that value, we could calculate how fast the IV is actually infusing. Now, alternatively, over 95% of hospital floors actually use what are called electronic IV pumps, purely because of their safety. Now, looking at the picture on the far right of this slide, you can probably see why. Because you can see in an IV electronic pump, it displays exactly how fast the IV set is infusing. Now, Whenever you're administering an IV medication, you will need to know certain parameters such as flow rate, infusion times, and total volumes. Each of these parameters now will vary based on the purpose of the IV therapy, as we discussed above, and is why we actually need to learn how to correctly calculate these values. So with that as enough of an introduction, let's start practicing some of these calculations. All right. Well, let's look at our first question, and we'll read the question to begin with. It says, a medication order calls for acyclovir, 355 milligrams, to be administered by intravenous infusion over 60 minutes. A 500 milligram vial of acyclovir is available, and we're instructed to mix that vial with sterile water for injection to prepare 10 milliliters of the injection in the vial. Now, the proper amount of acyclovir from that vial will then be taken, withdrawn from the vial, and injected into a 100 milliliter of normal saline solution. The question therefore asks us to calculate the following three things. First, the volume to be taken from the vial of the mixed acyclovir. Secondly, the rate of infusion of the final IV bag in milliliters per minute. And then third, change that infusion rate for the nurse into expressing it as in drops per minute, since the nurse will be using an intravenous set that is calibrated to deliver 20 drops per milliliter. Okay, so a lot of information, but let's just take a break for a second. And a little bit of background about acyclovir is that it's an interesting drug. It's actually a synthetic nucleoside analog, meaning it's kind of like a fake piece of DNA that tricks a virus and keeps that virus from replicating because it uses essentially the acyclovir, which doesn't work in its replication. So specifically, acyclovir has potent activity against the herpes simplex viruses, both types 1 and 2, and to a much lesser extent, the varicella zoster virus that causes chickenpox or shingles. Now, clinically, acyclovir is indicated to treat herpes virus infections of the lips, the genitals, the central nervous system, and to some extent, the symptoms of chickenpox and shingles. Now, because these variety of infections can manifest in many different locations in the body, I think acyclovir is interesting because it's commercially available in many different dosage forms, including its use orally in capsules as well as tablets, as well as oral suspension, liquid for children, and even what they call buccal tablets, which means that they're dissolved in the mouth, in the cheek, against the cheek. That's all just oral use. Now, acyclovir is also available topically. You can use it, again, especially for the lip infections, as a cream or an ointment. And then lastly, even as used in this example, intravenously, so as a solution for injection. So getting back to this question, we need to administer acyclovir to treat some sort of herpes simplex virus, and we want to administer it via an IV solution. So let's rewrite some of the information. The important information we need to get is that the dose of acyclovir we want is 355 milligrams. We're going to obtain that dose using an IV vial, a drug vial, that contains more than we need. It actually contains 500 milligrams, and that 500 milligrams, when reconstituted, will be in a total volume of 10 milliliters inside the vial. So then we're going to take what we want out of the vial and inject it into a bag that already contains the 100 milliliters of normal saline, and that would be our final IV product. We then need to label that for the nurse so that the nurse can administer that IV fluid over an infusion time of 60 minutes. So with that information, let's begin answering this question. So I've rewritten that information here, and I'll remind you the first question was to determine the volume to be taken from the vial of the mixed or reconstituted acyclovir. So I'll show you my equation here, and let's start with, where do we start with? What do we want? We want 355 milligrams of acyclovir. So that's the dose that we want. To get that dose, we simply need to look at the concentration of the drug in the vial. And we said the vial contains 500 milligrams, and we're going to reconstitute it into a final volume of 10 milliliters. So let's multiply it by the concentration, though, expressed as 10 milliliters on top over the 500 milligrams of drug. And we multiply this way so that the units of milligrams will cancel, and we'll have a final value of, and if we do the math from left to right, you would get 7.1, and the units would be milliliters. So essentially, if we take 500 milligrams of acyclovir and dissolve it in a total volume of 10 mils, and we withdraw 7.1 mils out of that vial, that 7.1 milliliters will contain what we want, which is the 355 milligrams of acyclovir. So again, we're going to withdraw 7.1 milliliters from our drug vial. And that's the answer to question 1. The second part of this question asks us to calculate the rate of infusion in the units of milliliters per minute. And an infusion rate, regardless of the specific units, I want to make sure you understand, are basically some volume over some time. It's milliliters per minute is volume over time, and in this case, time expressed in minutes. So here's my formula, but what's important is to start on the very top. The first part of an infusion unit is milliliters. So what is the total volume? This is extremely important to understand. The total volume we're infusing is a combination of the IV bag we started with. Remember, we had a 100 milliliter bag of normal saline to begin with. We then injected into that bag our acyclovir. But our acyclovir dose of 355 milligrams we just calculated was going to be 7.1 milliliters of fluid out of the vial. So essentially, we took a 100 milliliter bag and injected into it an additional 7.1 milliliters. So our actual bag total volume, when we've added the drug to it, is 107.1 milliliters. So the volumes are additive. So we take that total volume now and divide it, since it wanted it in minutes. We were told that the infusion time, this volume should be infused over 60 minutes. So we'll just take the total volume divided by the total time, which is 60 minutes. And if we do that math, you should get a value of 1.79 milliliters per minute. And if we infuse our IV at that rate, then the IV bag will be empty at exactly 60 minutes. And that's what we want. Now, the third question just goes one step further, because our nurse now is actually administering this IV bag in a set, and we'll need to program her pump or calibrate her set so that she knows how many drops per minute, not milliliters per minute, but drops per minute. Because we remember a lot of different gravity IV sets are going to be calibrated in drops per time. Now, the IV set we do know that we're using is calibrated to deliver 20 drops per milliliter. So given that calibration, we should be able to re-express the rate we just calculated in terms of drops per minute. So I show you my equation here. Remember, we'll start with what we just calculated, which was the infusion rate we want in milliliters per minute, which was 1.79 milliliters for every 1 minute. And then we're just going to multiply that by the calibration of the IV line, which was given to us as 20 drops per milliliter. And if we multiply by it expressed as 20 drops over 1 milliliter, then we can see that the units of milliliters will cancel, and our final answer would be in drops per minute. And doing the math across, we see that 1.79 milliliters per minute is the same as 36 drops per minute if we use an IV set calibrated to deliver 20 drops per milliliter. So that concludes this question, and it just illustrates again how we need to label our IV products in different ways depending on how the nurses need to administer that IV set. And in this case, if we were using a pump, the nurse might just be fine to know the administration rate in milliliters per minute. But if they're going to be administered via gravity, then they're going to need to know the infusion rate in drops per minute. All right, this next question is very similar, but I chose it because it involves the drug heparin, which instead of being dosed in milligrams like our acyclovir, is actually dosed in the units of activity. So we'll see how that changes or affects the calculations. So the question reads, a patient is receiving 500 milliliters of an intravenous drip containing 25,000 units of sodium heparin in dextrose. It wants us to calculate two things. First, the administration rate now in milliliters per hour to deliver 1,200 units of sodium heparin per hour. And secondly, the administration rate re-expressed in drops per minute, now using an IV set that actually delivers 15 drops per milliliter. Okay, just a really quick background. We've talked about heparin before in these podcasts. It's a common drug used, especially in a acute care or hospital setting, because unfractionated heparin is used to thin the blood. and can either be used to prevent blood clots from forming, especially if you're in an IV bed immobile for long periods of time, or oftentimes to actually dissolve an existing clot if that's the reason that you're in the hospital to begin with, is because you've developed a clot somewhere. And we'll assume that's kind of the situation in this case. We're using a relatively high amount of heparin, so we're assuming that we're wanting to keep a clot from getting worse. Having said that, let's rewrite the important information for solving this question. That includes that our dose of heparin needs to be 1,200 units per hour. Now, to provide that dose, we're going to use a pre-made IV bag that has the concentration of 25,000 units of heparin in a 500 milliliter bag. And to administer it, the nurse is going to use an IV set that will administer 15 drops per mil. So from that information, we can answer all of the questions we need. So let's get started. Rewrite the information here. The first question, again, wants us to calculate the administration rate in units of milliliters per hour to deliver 1,200 units of sodium heparin per hour. All right. So my formula is here. I guess where do we start with this question is starting what we want to deliver. What we want is to administer 1,200 units of sodium heparin per hour. But we need to express that rate not in units per hour, but in milliliters per hour. So all we need to do is multiply it by the concentration, but we want to express the concentration of our premixed bag in a way that our units will cancel correctly. So we're going to multiply by the fact that in our pre-made bag, it contains 500 milliliters. We're going to set that over the number of units of heparin, which was 25,000 units. And if we multiply it in the values expressed this way, we can see that the units of activity will cancel, and our final answer will be expressed in milliliters per hour. So if we do that math, you can see that our final answer would be 24 milliliters per hour. That would be the administration rate we need to use. That's the rate that would deliver 1,200 units of heparin per hour. The second part to this question asks us to essentially convert that administration rate into drops per minute, since the nurse will be administering it using an IV set that delivers 15 drops per milliliter. Okay, so I show you my formula here. Where do we start on this question is what we just calculated. We know we want to administer 24 milliliters per hour. We just need to convert that for the nurse into the units she needs or he needs, which are in drops per minute. So you can convert mils to drops or hours to minutes in whatever order you want. I chose to let's first convert the volume. So what I'm going to do is take my infusion rate in mils per hour and multiply it by the calibration of the IV tubing, which we were given as 15 drops on top over 1 mil. And I multiplied like this so that my units of milliliters will cancel, and I'm now in drops per hour. The last step is to convert the units of time, so I'll multiply that by the fact that in every 1 hour there is 60 minutes. That way my units of hours will cancel, and my final units will be in drops per minute. And if you do that math, 24 times 15 divided by 60, you can see that the final value would be 6 drops per minute. So essentially, 6 drops per minute using a set that has a calibration of 15 drops per mil is the same as administering that fluid at 24 milliliters per hour, and those are the answers to this question. All right, this next question is the type of calculation you would perform in more of a critical care type setting. So let's read the question. It says, a medication order calls for esmolol hydrochloride premixed solution that contains 2.5 grams per every 250 milliliters of normal saline to be given for the rapid control of ventricular rate, meaning heart rate, in a patient who weighs 143 pounds. Now, the doctor has dosed this infusion to be run at 50 micrograms per kilogram per minute. That's what it's dosed at. So what we need to be able to do is to calculate for the nurse an infusion rate of this pre-mixed solution in the units, though, of milliliters per hour. All right? Now, a little bit of background is that esmolol is an extremely short-acting, what they call beta-1 selective beta blocker. And essentially, a beta-1 selective beta blocker, blocks the beta receptors located specifically on the heart for the most part. And what this does is block the sympathetic nervous system. Since the beta receptors are the adrenergic receptors, they block the sympathetic nervous system, which means they block the way the body has to increase or to speed up the heart rate. Since you block that, then the heart rate is going to naturally slow down. Now, however, unlike other beta-1 selective beta blockers such as metoprolol or atenolol, esmolol is only administered via an IV infusion. So, and because of its extremely short duration of action, it's actually very useful for the acute kind of life-threatening conditions in a hospital of either really high blood pressure or, as in this case, really fast heart rate, often caused by what they call supraventricular arrhythmias, which is basically an abnormal conduction in the atrium, and that atrium is beating too fast and making the heart rate go up. So we want to slow it down by blocking the adrenergic system there in the heart. So with that as a background, let's rewrite the information we need to actually solve this question. So the important information we need to take forward is that in this question, the patient was told to weigh 143 pounds. That's going to be important. What do we know about the drug is that it's dosed at 50 micrograms per kilogram per minute, and we're going to provide that dose using a pre-mixed bag that has a concentration of 2.5 grams in 250 milliliters. So with that information rewritten here, let's solve this question. And I'll remind you what we're trying to calculate here is an infusion rate in the units of milliliters per hour. So where do we start? I'll show you my formulas here. Where we start is with the patient. We're going to base our dose off of our patient. So what is our patient's weight? We were told their weight was 143 pounds. So the first thing we have to do is convert pounds to kilograms. So we're going to do that by multiplying by the fact that in every 1 kilogram, there are 2.2 pounds. This way the units of pounds will cancel and we will be in kilograms, the weight of our patient in kilograms. We'll take that weight in kilograms and multiply by the dosing amount. And the doctor told us to dose 50 micrograms for every kilogram and every minute. So it's 50 micrograms per kilogram per minute. Set up in this way, you can see the units of kilograms will now cancel when we multiply, and we will be in the units of micrograms per minute. After that, my next step was to go ahead and let's go ahead and convert from our units of minutes to hours, because we want our infusion rate per hour. So I chose to multiply by the fact that there are 60 minutes in every 1 hour. This way you can see the units of minutes cancel, and at this point, if we do the math all the way across, we would get mathematically 195,000, and the units would be micrograms per hour. So we're not done, but we now know, given our patient's weight, the infusion in micrograms per hour. So let's continue. So I've rewritten that same information down here, our 195,000 micrograms per hour. Now let's convert micrograms. So my first conversion step is to convert micrograms to milligrams. So I'm going to multiply by the fact that in every 1 milligram, there is 1,000 micrograms. Micrograms cancel, and we're in milligrams. We're not done yet. I need to get to grams. So my next conversion is to convert from milligrams to grams by multiplying by the fact that in every 1 gram, there is 1,000 milligrams. Units of milligrams cancel, and now we're in grams. We're in grams per hour. But we need to go from weight or grams to volume. And this is the step that a lot of students still get confused at. We're going to convert that by using the concentration of our pre-mixed bag, but expressed as 250 milliliters on top over the 2.5 grams of drug. And we did that so that you can see the units of grams will cancel, and our resulting final units will be in milliliters per hour. And if we multiply and do the math all the way across, you should obtain a final answer of 19.5, and therefore the units for that would be in milliliters per hour. That's the infusion rate in volume per time, milliliters per hour, that would provide the correct dose, which is 50 micrograms per kilogram per minute, for our patient who weighs 143 pounds. So hopefully that's kind of working backwards, but that is the correct infusion rate we would need in this sort of critical care type setting. All right, this next question involves calculations needed for the preparation of IV solutions containing various monoclonal antibodies and as a therapeutic agent. And this is becoming much more common now. There are many more FDA-approved antibody solutions approved to treat a variety of different disease states. So let's start by reading this specific question. And it says, cetuximab, which has the brand name Erbitux, is an injection to be used by intravenous infusion in the treatment of certain cancers, primarily head and neck. It has a recommended initial dose of 400 milligrams per meter squared to be administered over 120 minutes and with a maximum infusion rate of 10 milligrams per minute. The injection itself is supplied as single-use vials, as shown on this picture here, containing cetuximab 100 milligrams per 50 mLs. So with all that information, though, what the question really is asking us is that using the body surface area equation, calculate the dose for this patient who weighs 154 pounds and measures 5 feet 8 inches in height. Also, how many milliliters of the cetuximab injection will provide the dose required? And lastly, if the calculated dose is to be administered over the 120 minutes, what would the rate of flow be in units of milligrams per minute? All right. So a little bit of background before we do the math. I think this drug is interesting. Cetuximab is a recombinant, I like this part, human-mouse chimeric monoclonal antibody that is used to inhibit the epidural growth factor receptor, abbreviated EGFR. Now, this EGFR is a protein that is abnormally overexpressed in many cancers, and the inhibition of EGFR by this drug results in the decrease in the tumor cell growth and decreased production of other factors responsible for metastasis or spread of the cancer. Now, I think that what's interesting is that a chimeric antibody is an antibody made by combining the genetic material from both a non-human source, like a mouse in this case, with the genetic material from a human being. This chimeric antibodies are generally around 2/3 human, which is necessary to reduce the risk of reactions to foreign antibodies from a non-human animal like the mouse when they're used in these sort of therapeutic treatments. Now, unfortunately, though, treatment with cetuximab can still result in some very severe life-threatening reactions, including cardiac arrest or heart attack or sudden death. Therefore, you have to really closely monitor things like the serum electrolytes of magnesium, potassium, and calcium during treatment with cetuximab. So, interesting new drug, but certainly poses some risks. So clearly we want to infuse it correctly. So going back to the question, let's rewrite the information we need to know. We definitely need to know some stuff about the patient, specifically that the patient weighs 154 pounds and stands 5 feet 8 inches in height, and that's all important because we're going to have to calculate their body surface area. And we know that because if we look at the drug information, the drug is dosed as 400 milligrams per meter squared. Okay, so when we do finally have the dose, we're going to use the vial, which has a drug concentration of 100 milligrams per every 50 milliliters to provide the dose. And then when we infuse it, we know we're going to infuse it over 120 minutes and that our final infusion rate can't be any higher than 10 milligrams per minute. That maximum helps us prevent all of the very bad infusion-related reactions that can occur. So we definitely don't want to exceed that. We don't want any bad thing to happen to our patient when we give them this drug. So with that information, let's start with, before we get into the actual dosing part of it, we need to calculate this patient's body surface area. So we'll start with a reminder of the Mosteller body surface area formula, which was to take the height, and be careful with the units here, we need the patient's height in centimeters times their weight in kilograms. We divide that by 3,600 and be sure and take the square root of that. And that would give us our value in meters squared. So let's start with this patient's height. So I'll remind you here the patient stood 5 foot 8. So if we start with the first 5 feet, we'll take the 5 feet times 12 inches per foot to get the number of inches. And so 5 feet is equivalent to 60 inches. We'll then add that to the patient's additional 8 inches. So 5 foot 8 would be 60 inches plus 8 inches. So our patient actually stands 68 inches in height. Let's multiply it by the conversion that there are 2.54 centimeters per inch. And our final value for this patient would be that they stand 173 centimeters tall. Okay. Now let's go to their weight. We were given 154 pounds. If we multiply that by the conversion of 1 kilogram, there are 2.2 pounds, so that the units of pounds cancel. We can see that this patient weighs the equivalent of 70 kilograms. Now we can actually calculate the body surface area. So I'll set up the formula like this, and we'll take their height of 173 centimeters times their weight, which is 70 kilograms, divide that by 3,600, take the square root of that, and you should get a final value for this patient's body surface area to be 1.83 meters squared. Now, with that information, we can actually go to answer the questions. So, rewriting some of the information on top there, I'll remind you the first question was, after you find the patient's body surface area, simply calculate the dose for this patient. So here's the formula for doing that. I'll remind you we just calculated that this patient's body surface area is 1.83 meters squared. So let's multiply that by the dose, which was 400 milligrams per meter squared. Meters squared will cancel, and we'll have final units of milligrams. So 1.83 times 400 should give us a value of 732 milligrams. So that's the dose of cetuximab we need to give to our patient. The second question says, okay, well, given the vial that you're going to use, the concentration, how many milliliters will provide the dose that you want? So we'll start with the formula and remind you what we want is 732 milligrams. So we just need to multiply that by the concentration. But set up in this way that we put 50 milliliters on top over the 100 milligrams contained in that 50 mils, so that our units of milligrams cancel. So if we do the math in this way, milligrams cancel, and our final value, if you do the math, would be 366 milliliters. That's the volume of the injectable we need to provide us the 732 milligrams. And then lastly, it says, what would the flow rate be in milligrams per minute if we administer that over 120 minutes? So it's relatively straightforward because remember, we know that we want to administer 732 milligrams, and we're told we need to do that over the 120 minutes. So 732 milligrams divided by 120 minutes gives us units of milligrams per minute, and our final value would be 6.1. So 6.1 milligrams per minute over 120 minutes would administer 732 milligrams. And more importantly, we would want to check this value against the safety because we were given a maximum infusion rate of 10 milligrams per minute. If we exceeded that, we're going to be at risk for side effects. But clearly, 6.1 milligrams per minute is less than our 10 milligram per minute maximum, so this should be a safe rate at which to infuse this drug. All right, this last question is a little different, or starting a little bit different, because the main emphasis for this last question is to practice really obtaining some of this information you need to do different types of intravenous medication calculations, but obtaining that information directly from a label of a commercial product. So what we have here is an image of the drug label, and let's practice obtaining the information we would need to be able to answer some questions. So the first thing to interpret from this drug label, which was a vial of IV medication, is that the drug name. What is the drug name? Well, be careful because remember, drugs have two names. So the first thing to get off of here in this case is the brand name. The brand name of this product is Camtosar. Okay. Now, all drugs initially come out with both brand names and generic names, but if they've been used for a long time, they may no longer refer to it, or if it is a generic product, it won't have a brand name, it would only have the generic name. This has a brand name, so it's obviously, in this case, not off patent or not available maybe as a generic. We are actually using the brand name Camtosar. And while that's useful, what's probably more important, especially in a hospital setting, is that Camtosar is the brand of what is the generic name, what is the actual drug for Camtosar, and it is irinotecan. So this is a drug, irinotecan, that is being sold and marketed under the name Camtosar, but the way you would see it most often dosed and labeled in a hospital setting is by the generic name irinotecan. So even though it's got smaller print on this label, it's probably the more important information, okay? So our drug is irinotecan. What's the next important information? And this highlights why we chose this label. This makes it a little bit confusing because this looks like a concentration, and it is a concentration, but it's not reduced. So what is it telling us? What this is telling us is that the total amount of drug in this vial is 100 milligrams. That's the total amount of drug. And it's also contained in a total volume of 5 milliliters. So there is 5 milliliters of solution in the vial, and the total drug is 100 milligrams in that 5 milliliters. So if you just do the math, you can realize, and probably what's maybe even more important to some extent, is that every milliliter in the vial contains 20 milligrams. So the concentration of the drug in this vial is 20 milligrams per milliliter. Okay, but since there are a total of 5 milliliters, that 5 milliliters would put a total dose of 100 milligrams. So to extract off of that information, just kind of mathematically here, you can see what we've talked about so far is that from the label, you can tell that this is the brand name product Camptosar, which is the generic, which has the generic, or the actual drug is irinotecan, that there is 100 milligrams total in the vial, and the vial contains a total volume of 5 milliliters, but the actual concentration of each milliliter in the vial is 20 milligrams per milliliter. Okay. Other information to point out on this vial that's important would be that this is a medication that it can only be used intravenously. It says for intravenous use only, which means you can't administer it via intramuscular injection or subcutaneous injections or other forms of administration. It's only IV. Okay, and that's because it also states that it is a cytotoxic agent, meaning it is a chemotherapeutic agent. That has a lot of safety implications because you have to be very careful in how you prepare that dose and administer that dose to avoid some serious side effects related to it being a chemo drug. Okay, it also provides us some information about storage, that we want to protect it from light and freezing, and some other information, but those are really the highlights. Now, the reason I chose this question is to kind of practice looking at that label. There are a series of questions here that we're going to answer, but I won't read through those now. We'll do each one of those questions one at a time, but we will be using the drug and the information obtained from the drug label, where it came from. So with that, let's actually start to try to answer each of those questions. So here's that information from the label, and the first question is this. We want to take the contents of this vial and are going to be added to a 5% dextrose injection to prepare an IV fluid. Now, this final IV fluid solution has to have a concentration in the range of, on the low end, at 0.12 milligrams per mil, to a different solution that would have no more than 2.8 milligrams per milliliter. So we're going to prepare two different concentrations of this drug. It wants to know how many milliliters of infusion can be prepared for each concentration, assuming we are going to use one vial of this drug. So using one vial of this drug, given the two different concentrations we want to prepare, what's the maximum volume we could prepare? This is essentially what it's asking. So let's start this question by separating the low concentration from the high concentration. And let's start with the low concentration. So given the low concentration that we want to prepare, where do we actually start with? To prepare the concentration, how much drug do we have? Well, if we use one vial, we know we have a total amount of 100 milligrams. So if we take what we have to start with in the vial, which is 100 milligrams that we can pull out, then multiply it by the concentration we want to prepare, expressed though in terms of the units of, for every 1 milliliter on top, there would be 0.12 milligrams of drug. So that is the low concentration we want to prepare. We express the concentration this way so that when we do the math and we multiply by the 100 milligrams, the units of milligrams will cancel, and you'll see that we'd have a final value of 833 milliliters. So what that says is that if we took 100 milligrams out of that vial and basically mixed it with enough dextrose so that our final volume had 833 milliliters, that would provide us that low concentration of the 0.12 milligrams per mil. Let's do the same thing for the high concentration. So remember, we're starting with the same vial, so we would have the same 100 milligrams to start with. Now we multiply it by the higher concentration, expressed as for every 1 milliliter, there's 2.8 milligrams. The units of milligrams cancel. We would get a final value of 36 milliliters. And you'll note that's a much smaller number than the previous value we calculated, and that's because we want to prepare a much higher concentration. So if we take the same amount of starting drug, the 100 milligrams, but now dissolve that or disperse it in a total volume of 36 mils, we're going to get a much higher concentration. That would give us our 2.8 milligrams per mil, which is certainly much higher than when we take 100 milligrams and disperse it in 833 mils. That just lowers the concentration to a much lower value of the 0.12 milligrams per mil. Either way, that's how you could calculate how much volume you could prepare from the same amount of drug, depending on the concentration you want. The next question says, all right, Now, if the concentration we actually want is the higher one, the 2.8 milligrams per mil, so if that's prepared, and the dose for a patient is actually 125 milligrams per meter squared to be infused over 90 minutes, what should the actual rate of infusion be in the units of milliliters per minute for a patient who has a body surface area of 0.8 meters squared? Okay, that's a lot of information there. So knowing where to start on these questions are always hard. Let's start with the dose. We want to know, starting with the dose of this patient and going from there. So my equation is given here. What we were told for this patient to make this dosing patient specific was that the patient's body surface area was 0.8 meters squared. So if that's what we start with, let's take that value and then start by multiplying that by the dose we were given. We were told to dose it at 125 milligrams per meter squared. If we multiply across, the units of meters squared will cancel and we will be in milligrams. Okay, that's the dose we want in milligrams. To get that dose, we are using a concentrated solution that was already prepared at the 2.8 milligrams per mil. So let's multiply the 125 milligrams times the concentration, expressed as for every 1 milliliter on top, it has 2.8 milligrams. And we do it this way so that the units of milligram cancel, and we multiply that all the way across, our final units would be in milliliters. So doing that math, we see that starting with a 0.8 meter squared body surface area times the dose, and then basically times the concentration expressed that way, we would need to use, of our concentrated solution, 35.7 milliliters. That would give us the correct dose. Okay, that's the volume of the solution we need, but the question wants to know the flow rate in milliliters per minute. So our last step is to take the volume we just calculated, we're going to have to administer, and divide it by the administration time. We want to infuse that volume over, and we were told in the question to infuse it over 90 minutes. So if we take 35.7 milliliters divided by 90 minutes, we would get a final answer of 0.4 milliliters per minute. So if we infuse our solution that contains 2.8 milligrams per mil, and we infuse that at 0.4 milliliters per minute, and we do that for 90 minutes, we would provide the correct dose for this patient. So hopefully you found this podcast helpful, and we did a variety of different calculations, but there's certainly some overall themes. You can see we emphasized flow rates, whether it's in milliliters per minute, milliliters per hour, drops per minute, lots of different units. So certainly the administration rate was the focus of this podcast, but you can see you can't get administration rate without knowing a dose, the amount of drug, or the total volume of drug to be infused. So it's really the combinations of all of those factors to be able to correctly calculate the types of questions you're going to have to answer when providing therapy for drugs administered intravenously.